my presentation. So the first one is principle of essentiality. Now essential, the word essential means important. So what does that mean? It means this principle emphasizes that human experimentation or experimentation on human subjects should be undertaken only when it is absolutely essential. It is important. Like if you should also consider alternatives also. Like some study can be done on a simulation software or it can be done on some animal experiment. Voluntariness or voluntary. Yes. Now what does that mean? First of all, it is your moral responsibility as a researcher to completely inform or fully apprise your subjects regarding the associated risks as well as benefits of the research. You have to be completely fair in telling them this research has these risks, these are the benefits. Never hide the risks. Then they should be informed about the right they can withdraw from the research at any time. It's not that once they have enrolled, they have to continue the research. At any moment, if they feel that the research is not benefiting them or for any reason, they have full right to withdraw from their research. Then, for that purpose, like Sir said, informed consent process is very important. That ensures that participants' rights are safeguarded. Means they are completely informed about the risks and benefits of the study. Then a consent is taken from them. Now, if the participant is illiterate, then what should we do? If a participant is illiterate, then what can we do? Any idea? That is legally acceptable representative should be hired. That person can sign the informed consent on the behalf of the participant. Third is principle of non-exploitation. Now, as the term non-exploitation means, like I just now told you before only, that participants should be selected. Once they are selected, they should be given the treatment fairly. Means there should not be any discrimination on the basis of caste, creed, color, or any social status, financial status. They should be completely devoid of any discrimination. Then, once the participant is enrolled, I just now told you that every research has some inherent risks. So, a complete mechanism should be decided from the beginning. If any anomaly occurs during the research, like if a patient dies during the research, so he should be compensated. His family should be compensated. So for that we have insurance cover. More than that, that is when it is fatal, when the research is fatal. Suppose the patient is coming to the hospital and taking part in your research. So he is missing daily wages. He is not going to earn that day. So for that, you need to give him travel reimbursement. You have to provide him, or you have to, if he suffers from any simple ADR also, he should be hospitalized and he should be treated, and that should be completely covered in the grant. Then principle of social responsibility. Now the name says social means society as a whole. Now that means what? Whenever research is planned or conducted, it should never deepen or any social or historical divisions, or it should not disturb any social harmony around you. So for that, what you have to do is you have to provide best possible care. Then the distribution of care should be equal among all the patients, and you need to protect the data of the patient. Privacy, confidentiality is very important. Like I'll give you one example. Suppose you are doing a trial on HIV drugs. So for that you need AIDS patients. So if the data of an HIV patient it becomes, if anybody comes to know, then they are not treated properly in the society. So in that case, you need to be very confidential in securing the data of the patient. Then whatever regulatory bodies have given you some guidelines, you need to comply to those regulations. Then at society as a whole, you need to raise awareness about the diseases and also the prevention methods. And lastly, there should be complete avoiding of harm to the environment. It's not like you have done the research, so you should discard your sample chemicals or anything into the environment and pollute it. That is not permitted. Then fifth one is principle of ensuring privacy and confidentiality. I just not talked about it. Identity and records of all the participants are kept confidential and access is limited to only those authorized. Now suppose I am the principal investigator, I am doing a trial. So I will have complete access to all the data. I know every patient has their identities revealed only to me. So when I will submit the data to the sponsor or to the regulatory, I have to hide the identity of the patient. I cannot reveal. I have to just show that this is the data generated from so and so patient, but I cannot reveal the identity of the patient. Then why this is done? This is to avoid any form of hardship, discrimination or stigmatization as a consequence of having participated in the result. But under certain circumstances, like when there is some suicidal ideation or some homicidal tendency and or some HIV positive status which can pose a threat to the society, then we need to breach this privacy, but only under consultation with ethics committee. Only taking due permission from ethics committee, you can disclose the identity. Principle of risk minimization. Now when we talk about benefit, risk is the other side of the coin of the benefit. So all stakeholders, these the investigators, the statistician, the sample collector, the regulatory, everybody, even the ethics committee members, it is their moral responsibility to ensure that risks are minimized. Whenever a study protocol comes to you and you read that protocol, ensure that the risk involved in that research is minimized, and if at all risk होगा ही, then what you have to do is you need to have some compensation. आपको पता है कि इस ट्रायल से ये होने वाला है, so compensation should be provided to the patient plus some appropriate care. Like if that study requires hospitalization, so you need to provide hospitalization to the patient. Best of care. Then for this reason, how to minimize? For this, professional as well as ethical reviews of research are undertaken at appropriate stages. Ethics का काम इतना नहीं है कि एक बार आपने study approve कर दिया खत्म. No. Once the study starts, you need to do interim reviews. भाई बीच में आपको review करना है whether they are following the regulatory guidelines or not, whether they are following the protocol or not. There should not be any deviation from the protocol also. Has to be checked by the regulatory, that is by the ethics committee. But even when the sponsor has given the right to the investigator to do the study, sponsor भी अपनी तरफ से एक monitor भेजता है who comes and checks whether the data they are collecting that is authentic or whether it is fabricated. That is also very important. So monitor, auditors, they are also appointed. So these people, they check whether risk is minimized or not. Next is principle of professional competence. Now this is very important. Why research करना है, so you should be competent first, isn't it? ऐसे you cannot tell any nurse to do the research. No, it has to be someone who is competent. Qualification, experience plus training to do that research. Then he should act with total integrity and impartiality. He should never be partial. Lastly, he should be aware of all the ethical considerations related to the research or experiment. That is why we are doing this GCP training, because a day will come when any of you will go and do some research. They will get involved in clinical trials. So you should be aware of the guidelines behind research. Number 8 is principle of maximization of benefit. जब risk की बात की है तो benefit तो आएगा ही. तो हम जब भी whenever we design or conduct a research, we make sure that directly or indirectly we are going to maximize the benefit. ऐसा नहीं research करना है, paper बनाए तो research करते हैं, नहीं. It should have some benefit to the participant as well as to the society as a whole. 9th is principle of arrangements. Now this comes in to the institute. आप researcher हैं, आपको research करना है. So what is the responsibility of the institute? Now institute should have some policies that can govern what sort of research you are going to do. Lastly, it should facilitate, it should provide you some facilities like infrastructure, and lastly, most importantly, training to conduct Number 10 is principle of transparency and accountability. Now, whenever you do a research, how does it come to the public domain? It comes to the public domain in the form of reports, registries, articles, and many publications like your research publications. Now, whenever you publish a research, do you write the name of your patient? Do you disclose the identity of the patient on which you have done the research? That is most important. You are disclosing the data you have collected without violating the rights of the participant. Yes? Sorry. Now, whenever you are doing some research, you have to make one thing, keep it in mind, one thing in mind, that is conflict of interest. So, you need to mention about the conflict of interest also and manage it properly. Like, suppose you are doing a research. Now, can anybody give me example of conflict of interest? Anybody conflict of interest? You might have written papers. What is
authors also?
Yes, suppose you are doing a research and you have got funding from that same pharmaceutical company. So that means there is conflict of interest. You may be biased in giving results. So that conflict of interest has to be kept in mind before doing any research. Research should be conducted always in fair, honest, transparent and impartial manner. That is what we are doing. That is principle of transparency and accountability. Mostly, whenever you do research, especially talking about clinical trials, you need to safeguard the related records, data, notes. They should be retained for the designated period. जितने पीरियड तक आपकी रेगुलेटरी बोलती है कि आपको ये सारी चीजें संभाल के रखनी है, आपको रखनी है. You cannot just, you have done the research, you have published the article, you cannot just throw the data. You need to safeguard it, you need to keep it safe up to the particular years, like 5 years, 10 years, 15 years, based upon the regulatory requirements. Then, principle of totality of responsibility. Now, whoever is doing the research, he is responsible, but others are also responsible, like ethics committee members, the regulatory body, the auditors, the monitors. So all stakeholders which are actually designing the research, which are actually doing the research, and even the statistician who is doing the analysis, they are also responsible for their actions. So they are directly and or indirectly bound to professional, social, moral responsibilities which comply with ethical guidelines and the related requirements. The research or experiment is duly monitored and constantly subject to review and remedial action in all stages of research and its future use. I told you, monitors we have here, auditors who come and review what research you are doing. If they find any flaws, then they tell you to mend it. And principle of environmental protection. Last but not the least, environment. Researchers are accountable for ensuring protection of the environment and resources at all stages of research. Means whatever, at every stage, you cannot just ignore the environment. कि आपने research करना है environment या environment, वो नहीं होना चाहिए. You need to keep complete check of whatever so that you do not harm the environment. And for that, you need to follow the existing guidelines related to environment also. Thank you. Now, we will take a short break for tea and come back after 15 minutes. Any questions? Sorry, I forgot to ask.
मैं पेशेंट अगर मर गया इसमें और फिर एनी रीजन तो कॉम्पेंसेशन देते हैं कॉज ऑफ डेथ
First of all, what they do is आपके लिए so that ADR उसको हम ADR ही कंसीडर करेंगे. We call it as SAE, serious adverse event. वो पेशेंट का डेटा हम रेगुलेटरी को भेज देते हैं कि मर गया है और फिर वहाँ से कॉजलिटी असेसमेंट भी होता है. इन्वेस्टिगेटर भी करेगा, फार्माकोविजिलेंस कमेटी, कॉजलिटी असेसमेंट कमेटी भी असेस करेगी कि ड्रग से रिलेटेड है या नहीं है. If they find it related to the drug, then they
अगर मेरी कंपनी है, मेरी अगर ड्रग है, तो कोई अगर क्लिनिकल ट्रायल कर रहा है, तो मैं उस पर प्रेशर डाल सकता है क्या ऐसा कि मतलब तू ये रिजल्ट दे बोल, ऐसा होता है?
होता है ना,
सही
होता है. ब्लाइंडिंग तब आ जाता है, ब्लाइंडिंग इन क्लिनिकल ट्रायल्स. ब्लाइंडिंग में
When you are going to stop the trial, trial कब stop करेंगे?
Trial कब stop करेंगे? If any adverse event occur.
In this context.
In this context, if that is the responsibility of the ethics committee. Ethics committee has to decide कि अगर ये drug की वजह से हुआ है and it can actually happen again, so they can prematurely terminate the trial.
So it is indirectly to the not related to the drug itself. For example, if the patient was coming for the clinic trial, met with the accident.
No. Then we don't know. Then we don't.
Basically,
तो
what
आपका
happens,
सर
in
मदर
that-
मॉर्टलिटी जैसा हो गया मदर प्रेग्नेंट है तो आपसे से मर गई इट इज नॉट काउंटेड एज मैटरनल डेथ
in that case, sir, we will not call it as an adverse reaction, but generally we make it as an adverse event, and it is serious adverse event. Then we will go for the causality assessment. Okay, basically, is that event is related with the use of a drug? Okay, so that is important. And then if it comes like that, then it's a decision of a sponsor. Okay. What action can be taken, and he is supported by the members of ethics committee.
तो मुझे कहते सेडेटिव ड्रग है टेस्ट और ड्राइव कर रहा है
Yes, sir.
एक्सीडेंट लगता ही हो गया एक्सीडेंट
So the sedation, accident will be considered as an event. If death is happening because of that accident, then it will be converted into the serious adverse event. And then we will have the causality assessment, and if we are reaching to the conclusion, okay, if that event, accident, because of a sedation, so sedation will be the serious adverse effect of adverse.
Again, sir, if it is mentioned in informed consent, you are prohibited for driving when you are taking this drug for this time, and patient has violated that consent,
Then
which
not
he has
covered.
given, then it- any of the. So there is a team of pharmacovigilance there, and they discuss, and they discuss.
Sir, I have one doubt. If we at all need pediatric patients for trial, so can you give some guidelines up to which age or after which age it is permissible? And secondly, what should be the protocols?
Basically, madam, the age group, so it depends on what type of research or what type of trial we are going to conduct. Okay, and then in that, when we are making a protocol, is essentially the knowledge of investigator. Okay, what he decides as an inclusion and exclusion criteria. So if that particular trial is targeting particular age group, then it is a very valid reason that we are including that age group. That is a simple thing. So your exclusion and inclusion criteria is the most important one. Okay. So pediatric group, now we can have from 0 to, suppose we can say 16 years. 18 years. Okay, we can have that much. But in which age group particularly you are targeting for that research, that is your decision. Okay.
Like for vaccine trials, you need to take neonates.
So it depends on that.
You have to take the consent of parents then.
Yes.
Of course.
Parents.
And they are legally accepted.
Only parents. Sir, एक क्वेश्चन, how much मतलब time you have to do the मतलब ये complete कर कितने time तक करते हैं research?
Depending on
the protocol.
1 year, 2 year.
नहीं आप कितने दिन तक उसका इफेक्ट देखना चाह रहे हैं?
Research on vaccine, BCG, you know it. You can carry the research till 10 years, 15 years, 20 years के कब इसका इफेक्ट, जब उसको अगर if a person has taken that vaccine and get exposed to that disease after 20 years, that will be written that after 20 years of taking vaccine. So that is
Continuous going on.
it is
Depends upon the protocol. आपने क्या decide किया?
what you have decided.
One drug is there, for example hypertension. तो तुम उसको कितने देर तक करेंगे और कितना डाटा लेना पड़ता है उसके लिए?
Sir, it is static. It should
Weeks, sir. At least 16 weeks.
16 weeks.
16 weeks. At least, yes. In few trials,
Or
they are
that-
doing it for 40 years, 50 years also.
Especially suppose we are doing
Lifetime
study
modification.
on ASP effectiveness. What dose is
So
effective?
वैसा है, it depends upon disease. You are studying acute disease or chronic diseases. Okay? And what type of medication you are using and what effect you want to see. जैसे न्यूरोपैथी का अगर पेन रिलीफ आपको देखना है प्रीगैबलिन you should be at least wait 6 weeks. उस हिसाब से ड्यूरेशन डिसाइड करें.
8 hours. And if suppose it is found later on that those who have lesser doses
Patient
of
number
ASP,
will remain the same.
mortality is also
Only
high,
duration will be
significantly
fixed.
high, and complications also high. Then is it considered as what means? It will be considered as you have done the harm for that patient by giving smaller doses, smaller boluses, or it can be.
You are denying standard treatment. You have to follow standard.
So, but somewhere, somehow, there must be the meta-analysis study to show that these are the कभी ना कभी तो करना पड़ेगा ना ये 30 का है ये स्टैंडर्ड है 100 अभी भी WHO बोलता है कि इंडिविजुअलाइज है तो कब मिलेगा ये इसका डाटा
एथिकल कमेटी की रिस्पांसिबिलिटी है जैसे कोई सीरियस एडवर्स इफेक्ट आता है या इवेंट होता है तो वो ट्रायल वहीं पर होते हैं
Sir,
और फिर
then we will not wait for the death of the patient.
जो भी सीरियस एडवर्स
You have started giving low
तो
dose.
ये जो है ना ये जो है एक्यूट सिचुएशन है ये क्रॉनिक डिसीज नहीं है एक्यूट सिचुएशन में इमीडिएटली भी होगा
तो सर
मतलब ये एक्यूट
रिसर्चर की रिस्पांसिबिलिटी है विद इन 24 आवर्स इट शुड बी इन्फॉर्म टू द एथिकल कमेटी
कि जितना भी डाटा अवेलेबल हुआ है रिट्रोस्पेक्टिव डाटा अवेलेबल है प्रोस्पेक्टिव स्टडी को इसको एथिकल कमेटी की यही नहीं दे परमिशन ही नहीं दे कहीं पर
That is the
इसका जो है तो दूसरे मेथड से ना मॉनिटरिंग करने के लिए
Correct.
वो भी कर सकते हैं ना अदर जैसे कि एस्पिरिन दे रहा है मॉनिटरिंग दूसरे भी कर सकते हैं कंटिन्यूअस देखते रह सकते हैं patient को.
नहीं इसमें
नहीं नहीं कुठंच देत नाही इट इज अ इश्यू ऑल ओवर द वर्ल्ड हाउ वी कैन नॉट मतलब टेक्निकल इश्यू इतना ज्यादा है
The process of collecting such data is retrospective and eventful only. It is a time-consuming process that a person is dying after taking this much dose only. If you are getting a retrospective data of that, then what is the meaning of preparing a prospective data of that dose? इसके लिए
सर का बोलना क्या है कि अगर सपोज वो ड्रग से का इफेक्ट नहीं आ रहा हम दे रहे और पेशेंट की डेथ हो जाती है तो उसके लिए अपन दूसरे मॉनिटरिंग भी कर सकते हैं जैसे कि आप एस्पिरिन दे रहे 2 पेशेंट में 2 ग्रुप्स में एक में जिसमें एमआई आने के चांसेस दो जिनमें है एक में एस्पिरिन दे रहे में प्लेसिबो दे रहे तो प्लेसिबो वाले को अपन कंटिन्यूस मॉनिटरिंग करते रहेंगे ना कि कहीं ईसीजी चेंजेस तो नहीं हो रहे जिसका ईसीजी चेंज नहीं हो रहा है उसको जल्दी से प्रिडिक्ट कर देंगे
मतलब मैंने कि 30 अगर आप दे रहे डोज और उस पे इफेक्ट नहीं आ रहा एडवर्स इफेक्ट हो रहे मॉर्बिडिटी हो रही तो इमीडिएटली उसको विड्रॉ अभी इसमें क्या है कि पेशेंट विल लूज द वैल्यूएबल टाइम है ना तब तक पूरा वो टिश्यू में जाके पॉइजन बैठ जाएगा उसके बाद में आप हायर डोसेज देंगे तो वो हो सकता है कि अब तो पॉइजन तो पूरा टिश्यू में जाके बैठा आप ये तो एसी तो कुछ नहीं करने वाला उसको इसका मतलब है उसका वाइटल टाइम आपने गवा दिया
प्रोटोकॉल में हमको सब ये सब
करेंगे उससे कॉम्पेंसेट करेंगे
नहीं अपने प्रोटोकॉल में सब ये चीजें मेंशन करना है
लीगल प्रोविजन
टू मैनेज ऐसा हुआ तो पहले से आपको डिसाइड करके रखना है पेशेंट इसके मेजर्स
और जो फर्की वाला जो ग्रुप है और फर्की वाले को ऐसा बोल दिया पति कैसा हो सकता है कभी करेगा नहीं होगा वही है और इसकी वजह से स्नेक बाइट के बारे में इतना प्रॉब्लम है और ऊपर से क्या है बहुत सेंसिटिव इशू है स्नेक बाइट लीगल इशू है एमएलसी हो जाता है तो और भी इशू हो जाता है
सर हम जो है ना तो यूजुअली वी वेट फॉर retrospective data we collect
आगे का बोल रहे सर
आगे का बोल रहे if you want to plan such prospective
डाटा पे इतना ज्यादा
I'm sorry to stop this. We are falling short of time. We can continue.
Hey, we will serve the tea here only.
हाँ अच्छा रहेगा क्या था
We can save the time.
Yes,
You can
yes.
come.
So we'll start, continue with our session. Now I call upon Dr. Syed Master to furnish our knowledge about general ethical issues in biomedical research. He will explain us the guidelines in detail. Thank you.
लैपटॉप अच्छे नहीं हो
एमएटी वाले
इसलिए मालूम है, इसलिए मालूम
नहीं हो ना लेकिन अपने को इंशाल्लाह
Good morning, all the respected faculties. You have to bear me a little more because the topic which is I am going to take is very overlap between the madam and Shafi sir. Okay? So, can everybody tell me what was the incident in the history? Yes?
वो जहर पिलाया था ना बच्चे को कुछ
No. हाँ बच्चों से रिलेटेड लेकिन कुछ और है.
उसके बच्चे को पिला दिया
In 1938, there is no rule regarding writing of the ingredients on the label of the drugs. Okay? So, if the scientists then wanted to give the sulfonamide in children, they prepared a oral formulation for the sulfonamide and they uses the diethylene glycol, okay, which is very toxic and it leads to the death of more than 100 children. Okay? So, after this incident, the Federal Food and Drug Cosmetic Act is come in 1930. The Nazi experiment is, Shafi sir already little bit highlight the Nazi experiment, but they are more religious one. The Nazis, they done experiment on brain freezing experiment, malaria experiment, high altitude experiment. They are so many experiments they done in the prisoner, which leads to the death of the thousands of the prisoners. Okay, which results in the formation of Nuremberg Code. Okay, Nuremberg Code it highlight the 10 memoranda, which is already covered by the Shafi sir, but he forget to tell that according to the Nuremberg Code, whenever we are going to study on the human subject, so we have to do the study in animal before doing on the human subject. Okay? These are the history and evolution of the biomedical research and good clinical practice in international level and in India. ICMR also provide the different guidelines for the biomedical research on the involving the human beings. Okay. Now these guidelines are established to ensure the clinical research which is going to perform have the high ethical and the scientific standards. Okay. Otherwise it is not going to done. Okay. The primary consideration for the research is to protect the right and the well-being of the participants and ensure the quality and integrity of the data. So today I am going to tell you about the general ethical issues which comes in the biomedical research. Okay? All research involving the human participant should be conducted in accordance with the basic and general ethical principles. But who is the responsible whether the trial is going on with according to the ethics and principles? Yes, is the ethical committee. Ethical committee is the solely responsible to monitor or see whether the trial is conducting in according to the ethics and principles. Okay? Now, in today's topic, we are going to see the ethical issues which comes around the human biomedical research are benefit risk assessment, informed consent process. The informed consent process will be taken by the Dr. Tibet in detail in afternoon session. Privacy and confidentiality, distributive justice, payment for the participant, compensation for the research related harm, and the conflict of the interest. Okay? So, first, the benefit risk assessment. What is benefit? Any favorable outcome of the research is come under the benefit. Okay? And what is the risk? Yes, what is the risk? Any discomfort or harm which is anticipated to occur to the human participant is the risk. Okay? Risk is divided into the 4 categories. That is the less than the minimal risk, low risk, and the high risk. Okay? So it is the responsibility of the ethical committee to maximize the benefit and to minimize the risk of the research. Okay? It is the responsibility of the ethical committee to assess the benefit and risk, and it is also responsibility of the ethical committee to ensure a favorable balance between the benefit and the risk. Okay? In the ongoing research, and also the ethical committee should evaluate the plan for minimizing the risk and discomfort to the patient. As sir told, सोलंकी सर जब भी कुछ ऐसा होता है जो ठीक नहीं है तो वहीं पर इसी कमेटी ने उसको इवैल्यूएट करना है और वहीं पर स्टॉप करना है। जैसा आप बोल रहे थे लोड उसमें देने के बाद भी अगर कुछ नहीं होता है तो एक्चुअली क्या है ये इट इज ए लो रिस्क कैटेगरी and it should be evaluated by the ethical committee and stop the research, and certain amendments should be formed in the protocols. Okay? Ethical committee should decide on the merit of the research before approving the informed consent process. Informed consent protect the individual's autonomy. Okay? To freely choose whether or not to participate in the research. Okay? Informed consent process, it involves 3 main parts. Okay? First, the researchers should provide the relevant information to the participants regarding the research. First, next, the researcher ensure that information is understood by the participant. Okay? So, informed consent process, it is having 2 parts. Okay? Patient information sheet and the informed document. Okay? So, the patient information sheet should be in 3 languages. Okay? It should be in Marathi, Hindi, and English. Okay? And lastly, ethical committee assure the voluntariness of the participant. Okay? I already told you informed consent document having 2 parts. That is the PIS and the informed consent form. Okay? Nowadays, for the PG research also, we have to form the patient information sheet, and it should be in the 3 languages. Okay? The primary responsibility of the research to obtain the written informed consent. Okay? Or legally acceptable representatives. Okay? If a participant or LAR is illiterate, then a literate impartial witness should also be present at the time of informed consent. Okay? Audio visual or audio recording of the informed consent is mandatory in certain clinical trials as guided by the CDSCO. privacy and confidentiality. What is privacy? Privacy means it is a right control or influence the information that can be collected and stored, and by whom and to whom it is going to disclose. ठीक है, इनको राइट है पूरा कि वो बोले कि आप जो भी पेशेंट की इंफॉर्मेशन है it should be confidential. ठीक है, and confidentiality is the obligation of the researcher. ठीक है, and the researcher team to safeguard the information and protect it from the unauthorized use and disclosure or modification of data. Okay? Researcher must inform participants that they protect the information, but in certain cases the information is going to disclose if the order is given by the court of law, or if the any harm to the life of patient or the community. Okay? Any publication out of the research should maintain the privacy of the participant or individual. Okay? If we are going to publish the photographs of the patient, then we have to take the re-consent of the patient. Okay? अगर आपको patient photograph publish करना है, then we have to take the re-consent of the patient before publishing those photographs. Okay? Next, so coding of personal information is necessary if the researcher is using the retrospective data. ठीक है sir? So and it should be limited. The data of individual participant or community may be disclosed in certain circumstances. That is, and it first we have to take the permission from the ethical committee. Then we have to disclose the personal information, and only in case of the if the orders are come from the court of law or threat of personal or community's life. ठीक है? Now, distributive justice. ठीक है? Individuals or communities which are undergoing into the research, they should be benefited or burdened or distributed among them. ठीक है? Vulnerable population should not be included in the research. What is the vulnerable population? I am going to tell you after some time. ठीक है? Research should not lead to the social, racial or ethical inequalities. ठीक है? Payment for the participation. Participant may be reimbursed for the expenses incurred related to their participation in the research. For example, for their traveling allowance, their food, accommodation, etc. ठीक है? Participant may also be paid for the inconvenience incurred, that is the time spent, their loss of daily wages, and this reimbursement should be in cash or kind or both. It can be decided by the ethical committee at the time of protocol. Okay? Participants should not be made to pay for any expense which are research related, including the investigation or patient workup, etc. Okay? When the legally acceptable representative is giving consent on the behalf of the participant, okay, reimbursement may be offered for the traveling allowance for the LAR. Okay? And it is the responsibility of the EC to assess the any reimbursement. Now, coming to the compensation for the research related harm. Okay? Research participant who suffered direct physical, psychological, social or any harm, okay, then they are entitled for financial or other assistance, okay, to compensate their disability or harm, okay. And in case of death, participants' dependents are entitled for the financial compensation, okay. The researcher is responsible for reporting or serious adverse effect to the EC within 24 hours of knowledge. Okay? A report on how to serious adverse effect events are related with the research. It must also be submitted within the 14 days. Okay? EC is responsible for reviewing the relatedness of the serious adverse effect and the research. Okay? For clinical trials, CDSCO already give the guideline, and the researchers have to follow these guidelines time to time. ठीक है? Participants who suffer harm, whether related to the research or not, should be offered appropriate medical care, psychosocial support, and medical facilities. ठीक है? Medical management should be free. The harm is related to the research. ठीक है? Compensation should be given to any participant when the injury is related to the research. Compensation for the research related harm if the students are involved in the research, then the institute becomes the sponsor, and in that case, it is the responsibility of the institute to compensate if any harm occurred to the participant. Ancillary care, okay? Participants may be offered free medical care for non-research related conditions. For example, if we enroll the patient for the research in the hypertension, and suddenly we found that patient is suffering from the other disease also. Okay? Then it is the responsibility of the ethical committee to treat that medical illness also apart from the research. Okay? Next, conflict of interest. What is conflict of interest? Actually, it is a state of condition where the professional judgment is little bit influenced by the primary interest is little bit influenced by the secondary interest, whether financial, personal, academic, or political. For example, in the case of the funding of trial, researcher wants that the drug is superior to the some other drug. Okay? This is the conflict of interest. Many times is the personal. For example, in our PG research, okay, we did not publish the negative result which our study group. So these are the conflict of interest. Conflict of interest can be at the level of researcher, ethical committee, institute, or the sponsor. Okay? If the conflict of interest is inherent in the research, then it should be declared at the time of protocol submission. Okay? It is the responsibility of the research institute to develop and implement the policies of interest and educate the staff about such conflicts. Okay? Researchers must ensure that they should submit the document related to the conflict of interest at the time of protocol submission. Okay? If the conflict of interest is within the ethical committee, then it should be managed by according to the SOPs of that ethical committee. Selection of vulnerable and essential groups. Population or vulnerable individuals are those that if a person having the higher risk of having any additional harm or they are unable to protect their own interests are known as the vulnerable population. It means like children and adolescents in under critical conditions, like if a patient having cognitive impairment, unconsciousness, and certain type of situational conditions like studies or research in the ethnic or religious group, research in the institution. If a country is going to research on the medical student, then the students are the vulnerable population. Why? Because they are unable to protect their rights because of the higher authority research on them. Okay? Such participants should be included in research only when the research is directly answering to the health need of them. Like Madam already said, if we want to do a vaccine study, then we have to take the children for the study. Otherwise, there is no option. Okay? The ethical committee should determine the vulnerability and ensure that the additional safeguard for these individuals. Now, certain diseases are very common in particular communities, like thalassemia. So, if we are going to do a study in that community, then the community can be engaged in many ways, and it can provide a valuable opinion. Okay? The engagement should depend on the type of research. Okay? Community advisory group can act as an interface between the researcher, ethical committee, and the community. So, but if we are involving the community, then the informed consent should also be taken. There is no excuse to exclude the informed consent. Okay? Members of the community represented in the ethics committee in the form of members, or they can be special invited. Post research access and the benefit. Okay? Benefit from the research should be made accessible to the individual community. So community may get benefit by the indirect way by improving their living condition or establishing the counseling centers, clinics or the schools. So the research team should make plans for the post-research access and sharing of the academic benefit as well as the clinical benefit with the individuals. All about fine for this topic. Thank you. Any question? I think majority of the questions are coming in the lab session, which is related to the my topic.
Whatever compensation is paid, is it confidential?
No, sir. Actually, it is the not confidential.
Institute, they have to show how much this compensation they have paid during their research.
Yes, in case of death. अगर डेथ होता है तो इंस्टीट्यूट ने करना है और
कॉन्फिडेंशियल रखना है क्या compensation जो पे किया पेशेंट को?
Basically, that there is before starting with the trial, you have agreements basically. So in that, that confidentiality will be broken between the investigator, sponsors, and participants. Related, other related with the clinical research or the trial, there is no necessity to disclose the things. But what happens eventually when they are deciding the compensation, all the ethics committee members, they are the one.
Yes.
Okay. So definitely it is open to them.
Institute to come in with the
इंस्टीट्यूट देगा क्या कंपनी पैसे?
institute are not entitled.
नहीं कंपनी पैसे कर देते हैं वो देगा।
अपने कम्युनिटी के हर किसी को लेता है ऐसा नहीं
How can we prevent the poison by the principal investigator? Then most of the trials are सर एक ही वॉलंटियर्स इधर भी जा रहा है दूसरे ड्रग का भी ट्रायल ले रहा है ऐसा होता है
सब उखाड़ में एक पूरा एक सेट ऑफ पीपल है, उनका काम ही वही है, उनको कॉम्पनसेट किया जाता है।
तो फिर उधर भी कर रहा है, ये ड्रग भी ले रहा, वो ड्रग भी ले रहा, तो कैसे स्टडी होता
हम लोग को नहीं
ठीक है ना, तो होता है लेकिन वो ऐसा पार्टिसिपेंट स्मार्ट है तो सब
कुछ नहीं कर सकते।
वल्नरेबल को प्रोटेक्ट कर सकते, स्मार्ट को नहीं कर सकते।
वो ऑफिशियली रहता है ना, क्या पता है, अब तो मतलब वो लीगल नहीं होगा।
इन गुड फेथ हो रहा है ना।
लेकिन सर अभी
Responsibility lies on the part of participant who is
Officially is not
Sir, जो information नहीं दे रहा उसकी responsibility है।
और वैसे करना तो क्या
अपने
है?
में नहीं आते।
अपने बात नहीं कि 2 इंस्पेक्शन में ज्यादा क्या
दस पैसे लेंगे तो 10
सर पहले क्या होता था कि ट्रायल्स में हाइपोथेटिकली पेशेंट्स दिखा दिए जाते थे, मैंने खुद देखा है। तो अब कैसा है, उनका आधार कार्ड भी ले रहे हैं।
आधार लिंक हो गया।
अब थोड़ा सा लेकिन उसमें भी कर लेते वो लोग जुगाड़।
आइडेंटिटी फिर रिवील्ड हो जाती है।
नहीं, लेकिन प्रिंसिपल इन्वेस्टिगेटर तक ही रहता है आधार कार्ड। वो आधार कार्ड जब आगे भेजा जाता है रेगुलेटरी को तो उसको हाइड कर देते हैं, पेशेंट का डिटेल्स हाइड कर देते हैं, लेकिन शेयर करना पड़ता है। नाउ आई कॉल अपॉन
here. Whatever we do in our life, there are rules for everything, right? When you are riding a bike, so there are certain traffic rules you have to follow. Okay, people seat nahi बैठना, you have to wear a helmet, or you will be fined. Okay, you are coming to Badnapur Medical College, you have to follow certain rules. Okay, 10 के पहले 5 हो जाती है, and 4 के बाद होना चाहिए, वरना your salary will be deducted. So similarly, when you are doing certain experiments or trials on human subjects, you need to follow certain rules, okay, certain guidelines, and these are guidelines. They are called as good clinical practices guidelines. Okay? And we will discuss today Indian GCP guidelines. Okay. So GCP is a ethical and scientific quality standard for designing, conducting, and recording trials involving participation of human subjects. Okay, this is called as GCP. What is the aim? Aim is to streamline clinical research in India. See, research will be going on here, it will be going on in Chennai, Mumbai, Pune. Okay, but there should be uniformity. Okay, all the researchers should. So the uniformity will make sure that the data which is generating is authentic, okay, and there is no bias. Okay, so what you see is whether that data is generated from. Then these guidelines have been formulated by CDS. Okay, any condition you take, you will get thousands of patients, and study will be completed like that. Second is, we have got well-trained, enthusiastic investigators all over the India. We will get good doctors who are doing research. Third, we have got premier medical institutes, and due to these premier medical institutes and high number of patients, even trials for rare disease is possible. Okay, you get patients for rare disease which you will not find in others. Okay? Then the cost is very low as compared to European countries. Okay, you can consider transportation of drug, storing, okay, compensation, everything. The total cost is very less. So now many pharmaceutical companies are opting India for clinical research. This is the main reason. Okay, low cost. There are certain prerequisites for the study. The first is the investigational product. Investigational product is the drug which you testers. Sometimes contrast X-ray लेते हैं ना, then contrast media also can be tested. Some pharmaceutical properties and the formulation of the investigation. Second is instructions for the storage and handling of the dosage form should be kept at so and so temperature. Should be stayed kept away from sunlight. So there are certain actions that you need to follow so that the investigational product is not damaged. Then any substance is not directly used in humans. Okay, first they are tested on lab animals, mice, rats, guinea pigs, rabbits. Okay, even monkeys also. So clinical supporting data should be there that shows promising results. So we have so supporting data should be there so that it justifies your use of these drugs in then protocol. Okay. See, whenever anybody makes a movie, so he acts on the script. So concept कहाँ dialogue होने चाहिए, romantic song कहाँ होना चाहिए, what should be the fighting sequence, everything will be according to the script. The director will not go astray from the script. Okay. So here protocol is the script for clinical trial. Okay. So it is a well-designed study. A well-designed study relies predominantly on a thoroughly considered, well-structured and complete protocol. Protocol आप लोगों ने भी देखा होगा also PG guides. So PG student जो research करते थे, first make the synopsis or protocol and they submit in front of ethical committee or academic committee. So this is similar to that only. Okay? So the first thing that the protocol should have is the general information. General information about the title, then the protocol number, date and amendments. बहुत सारे ऐसा होता है कि आप कुछ प्रेजेंट करते हैं एथिक्स कमेटी के सामने, एथिक्स कमेटी बोलता है नहीं एक्सेप्टेबल नहीं, do some changes, then you amend it, you again present it, so you need to write the amendment number also. Okay? Then name and address and contact number of the sponsor and the monitor or the CRO. CRO is clinician. Okay? इसका रोल क्या होता है मैं आगे बताऊंगा. Then name, title, address and contact number of the sponsors, medical expert for the study. Name, title, address and contact number of investigators consented. So investigators are doctors, जो लोग principal investigator हैं. Then names and contact numbers of institution, clinical. Then objective and justification for the study. Aim and objective 0, phase 1, phase 2, phase 3, phase 4. Phase 4 is surveillance. After that drug is drawn. But phase 0, 1, 2, 3. कौन सा phase है आपको mention करना है. Name and description of the investigation product. Findings from non-clinical as well as clinical studies. Okay. Then summary of risk and benefits. Then justification for the route of administration. कौन से रूट से आप देने वाले हैं ये ड्रग, डोजेज रेजिम क्या यूज करने वाले हैं, कितना आपका ट्रीटमेंट पीरियड रहेगा. This will be for both drug as well as control. Okay. Then a statement that the study will be conducted in compliance with the protocol, GCP guidelines as well as regulatory requirements in that particular country. Okay. In this instance, in India. Then various references, जो भी आप डाटा बता रहे हैं या आप कुछ इसके बारे में मेडिसिन के बारे में इंफॉर्मेशन दे रहे हैं और सपोर्ट कर रहे हैं, your justification, you need to give references from where you have taken those data. Then ethical consideration, general will be informed and how their consent will be obtained. Consent process का एक separate lecture रहेगा. Study design में एक आपका outline रहेगा कि आप study कैसे करने वाले हैं. First is you have to write the primary and secondary endpoints of your study. Then what is the type of study? Prospective है, retrospective है, then open label है या नहीं है, then कितने group वाली study है, right? Then whether study is blinded, okay? इसमें देखिए तीन चीजें रहती है, अगर पता नहीं होगा. सिंगल ब्लाइंड स्टडी रहती है, डबल ब्लाइंड, ट्रिपल ब्लाइंड स्टडी. सिंगल ब्लाइंड स्टडी में जो पेशेंट है उसको पता नहीं रहता है कि उसको कौन सा मेडिसिन दिया जा रहा है and in which group he will be put. In double blind study, both the patient as well as the investigator will not know which group will get which medicine. Okay, तो उसमें bias कम हो जाता है. तो क्या होता है, जो पहचान वाले पेशेंट रहते हैं उसको अच्छे वाले ड्रग के ग्रुप में डालते हैं, जो पहचान वाले नहीं रहते हैं ऐसा नहीं होना, उसके लिए डबल ब्लाइंड एक ट्रेंड स्टडी भी रहती है कि इवन अपार्ट फ्रॉम पेशेंट इन्वेस्टिगेटर द स्टैटिस्टिशियन आल्सो डजंट नो which group is having which medication. Okay, so this is blinding. Then which are the medication schematic representation. आपने सिनोसिस में देखा होगा पीजी स्टूडेंट्स के जो भी स्टडी कर रहे हैं इसमें फ्लो चार्ट बनाते हैं. This group randomization, इसकी एक ग्रुप में ये ड्रग दिया, ये ग्रुप में ये ड्रग दिया, follow for so many weeks and what are the parameters to be lost. Okay, flow chart बनाना है. Then what are the medications treatment permitted, including rescue medications and not permitted during the study and before. A description of study treatment dosage regime, you have already seen that. A description of manner of packaging and labeling of the investigational product, this will also be mentioned. Duration of subject participation. Okay, so there is one asking duration, so it will differ from study to study. Okay, so you need to mention how many days you need to follow the patient and what will be a study duration. Then proposed date of initiation, कब आप study start करना चाहते हैं. Okay. Then what will be a study center? कुछ studies जो रहते हैं it will be done in only one center and some studies are there that will be done in multiple centers for the same drug. These are called as multi-centric studies. Okay. Then what are your inclusion exclusion criteria? कौन से पेशेंट्स को आप इंक्लूड करेंगे? सबसे पहले तो वो पेशेंट जो कंसेंट देना चाह रहे हैं those will be included. And there are certain criteria. There's a pediatric patient, you will cut off the age, right? 18 के नीचे होना चाहिए, ऐसी चीजें. Inclusion and exclusion criteria. Then accountability procedures for the investigational products, what will be there? Maintenance of study, treatment, randomization codes and procedure for breaking codes. अभी randomization जो है ना उसके अलग-अलग तरीके रहते हैं. Okay? You can use a cheat method. There are computerized randomization methods also. उसमें codes दिए जाते हैं. तो वो codes आपको break करने नहीं देते. लेकिन emergency में अगर आपको break करना पड़े, कुछ lacune आ जाए study में, तो उसका क्या procedure रहेगा? That also you have to mention for breaking codes. Then procedures for monitoring subjects compliance. Okay, this is very important. कई बार बहुत सारे patients enroll तो होते हैं study में, but some drop out of the study. Okay, so whether the patient is taking that desired treatment or not. तो compliance आप कैसे देखेंगे उसके बारे में भी आपको लिखना है. Then handling of products. Measures to be implemented to ensure that the safe handling and storage of pharmaceutical product. Then system to be followed for labeling of product like code number, investigator name, name of the institute shall be followed. Then assessment of ये जो investigational product है आपका ये drug है इसकी efficacy आप कैसा monitor करेंगे उसका आपको लिखना है कि how effects will be measured and what will be the time period मतलब कितने दिन के बाद आप उसका effect देखना चाह रहे हैं maybe 6 weeks or 1 month okay like that. And description of the analysis or test कैसे आप उसकी efficacy देखना चाहते हैं. Suppose a patient is having kidney failure and you are trying to study some drug that is helping in relieving the kidney failure, right? So you might be testing kidney function test as a parameter. You might be testing EGFR. तो कौन से पैरामीटर से टेस्ट आप टेस्ट करना चाह रहे हैं वो भी आपको मेंशन करना है. And description of the special analysis and test also should be mentioned. Sometimes you need not just lab investigation, X-ray. Rickets में आप vitamin D का dose study कर रहे हैं, you need to study the histological changes. तो serological X-rays जो रहते हैं, वो X-rays के बारे में आपको लिखना है कि how you will monitor and कौन से part का X-ray आप देखना चाहते हैं. Then assessment of safety, specification of safety parameters, methods and periodicity of assessing safety parameters. Procedures for eliciting reports and for recording and reporting adverse drug reaction. उसका safety जो है drug का, that how you will measure adverse drug reaction के बारे में अभी हमारा discussion भी हुआ है serious adverse. You need to mention how you will monitor, how you will report. Then comes statistics. कि जो भी आपके पास में डाटा जमा हुआ है, how you will analyze that. Okay. Here comes the role of a statistician. So what are the parameters you will study, what test you will apply, and how you can, any software you are going to use. We usually use SPSS software, right? So Prism है, तो ये सारे software है, तो कौन सा आप use करना है? You even need to mention the versions of software that you are using. Okay? Then you need to handle data very important. ऐसे हो सकता है कि 5 साल के बाद में कोई पेशेंट आपके ऊपर केस कर दे कि मेरा एक्सप्लॉइटेशन हुआ था उस स्टडी में. So then you need to present the documents in the court. So you need to handle the data very carefully. You need to preserve and keep the data for minimum of 5 years. Okay? So ये सारी चीजें आपको मेंशन करना है. और CRM जैसा केस रिकॉर्ड फॉर्म है. PG स्टूडेंट भी जब केस लेते हैं एनरोल करते हैं स्टडी में तो एक केस रिकॉर्ड फॉर्म रहता है पर्टिकुलर ऑफ पेशेंट चीफ ये सारी चीजें क्या क्या आपने देखा फाइंडिंग्स पैरामीटर्स. So you need to preserve those CRFs also, case record forms. Then finances and insurance. ये स्टडी कौन फाइनेंस कर रहा है, कहाँ से इसका फाइनेंस हो रहा है. ऐसे नहीं कि आप कोई भी अननोन पर्सन आके फाइनेंस करेगा, इसमें ब्लैक मार्केटिंग हो सकती है. So you need to mention the source, how you will get the money and how you will spend it. इसमें पेशेंट्स पे कैसा स्पेंड हो रहा है. इवन जो डॉक्टर है इन्वेस्टिगेटर उसको आप कितना दे रहे हैं उसमें से. जो इंस्टीट्यूट में ये ट्रायल हो रहा है वो इंस्टीट्यूट को आप कितने दे रहे हैं. और जो दूसरे टेक्नीशियंस है, चपरासी है, अकाउंटेंट है, उनको आप कितना कितना दे रहे हैं. एवरीथिंग शुड बी मेंशन्ड इन द प्रॉपर. ओके, फाइनेंशियल डिस्ट्रीब्यूशन. एंड द सब्जेक्ट शुड आल्सो बी सैटिस्फैक्टरीली इंश्योर्ड अगेंस्ट एनी इंजरी ड्यूरिंग द ट्रायल. एक और चीज रहती है कि अब ट्रायल तो हो गया, आपके पास डाटा भी आ गया. अब पब्लिकेशन जो करते हैं उसकी भी एक पॉलिसी होना चाहिए कि पब्लिकेशन कौन करेगा. वेदर द कॉपीराइट विल बी विद द स्पॉन्सर या फिर इन्वेस्टिगेटर करेगा पब्लिश. तो दैट शुड आल्सो बी मेंशन क्योंकि बाद में फिर नहीं तो इस पे झगड़ा होता है. Then evaluation, we have already seen. The only thing we need to make is how you will monitor the dropout cases. जो dropout करने वाले हैं उनका monitor करेंगे और आप क्या करने वाले हैं. What will be your plan of action? इसमें एक और चीज थी जो मैं मेंशन नहीं किया कि how many you need to enroll. आपको एक sample is calculate करना होता है. You cannot enroll any number of patients, right? It depends upon कि जैसा आप डायबिटीज पे स्टडी करना चाह रहे हैं, you need to find how much is the prevalence rate of diabetes. From this prevalence rate, you need to calculate the sample size, and उतने sample patients should be enrolled in each group. Okay? Then ये already Shafi sir ने cover किए. I will not go into and madam maybe ethical principles. Then these principles also were highlighted by madam. एथिक्स कमेटी वेरी इंपॉर्टेंट. ओके, इसमें कौन से मेंबर्स होने चाहिए और कितने मेंबर्स होने चाहिए, कैसा वर्क करती है, मीटिंग्स कब होते हैं, व्हाट आर द रिस्पांसिबिलिटीज एंड रोल ऑफ एथिक्स कमेटी, ये सब सारा एक जुबेर सर अगले सब्सिक्वेंट लेक्चर में लेंगे. ठीक है. सिमिलरली इन्फॉर्म कंसेंट आई एम नॉट गोइंग टू स्पीक बिकॉज़ अगेन डॉक्टर जुबेर इज गोइंग टू स्पीक ऑन इन्फॉर्म कंसेंट. ओके. देन व्हाट आर द रिस्पांसिबिलिटीज. सबसे पहला स्पॉन्सर is usually the pharmaceutical company जो ये ट्रायल करवा रही है. ओके, उनकी जो रिस्पांसिबिलिटी है दैट सिलेक्शन ऑफ इन्वेस्टिगेटर कि कौन सा इन्वेस्टिगेटर रहेगा, कौन से इंस्टीट्यूट में उनको देना है ट्रायल. ओके, इट इज देयर रिस्पांसिबिलिटी. सेकंड, मेक अ लीगल कॉन्ट्रैक्ट, डॉक्यूमेंटेशन वो सारा इनका रिस्पांसिबिलिटी. Then forming a standard operating protocols, how this trial should be conducted and what are the timelines and everything is provided by the sponsor. Then allocation of duties and responsibilities to each member of the research team. Then study management, data handling and record is also a responsibility of sponsor. Then compensation for the participants. For the study, and if any injury occurs, is also responsibility of the sponsors, not the investigator. Then confirmation of the review by ethics committee. ये भी सारा review करना वो सारा उनको देखना पड़ता है. Though investigator will go and present, but the sponsors are also responsible. And information on the investigation products जो भी supply कर रहे हैं उसका सारा information इनको देना पड़ेगा. Then supply, storage and handling of pharmaceutical products is also responsibility of sponsors. Safety information about the drug is also their responsibility. Adverse drug reaction reporting, इसमें हम लोग क्या कहते हैं कि anybody can report. Okay? Investigator can report, the nurse can report, the pharmacist can report, even the sponsor can report. Okay, so keeping a tab whether the investigator is reporting or not should be seen by this. Then monitoring audits, these are all done by sponsor. Then they need to monitor all the centers, multicentric studies. We discussed in the previous session that the investigator can terminate the study if the drug is causing severe harm. But even the sponsor can terminate his own study if he feels that the drug is not good, causing severe bodily harm or causing death, and it's not safe to carry forward the study, he can stop. But he need to inform, take into confidence all the members of the team and then do it. Okay. Then coming to the responsibility of the monitor. Monitor is, he lies in between sponsor and the investigator. Okay. Usually they are certain organizations. They are called as clinical research organization. Okay. First thing is they should be adequately qualified, medically, pharmaceutically and scientifically. Okay. Then there are certain responsibilities. अभी देखिए आपका जो स्पॉन्सर है, सपोज फाइजर कंपनी है, फाइजर कंपनी विल नॉट गो टू मेडिकल कॉलेजेस एंड सर्च फॉर इन्वेस्टिगेटर और डॉक्टर्स, ओके, और द साइट्स. सो दे विल हायर वन कंपनी और इंस्टीट्यूट दैट विल गो एंड डू ऑल दिस. ओके, दे आर कॉल्ड एज क्लिनिकल रिसर्च ऑर्गेनाइजेशन. उनका रिस्पांसिबिलिटी रहता है टू आइडेंटिफाई द साइट्स वेयर द क्लिनिकल रिसर्च विल बी गोइंग ऑन, टू आइडेंटिफाई द इन्वेस्टिगेटर. ओके. Then supply of drugs. Okay. Then monitoring whether the investigator is doing the research according to the protocol or not, or whether it is deviating. He need to inform to the sponsor there is deviation in that. Okay. तो ये सारी चीजें जो है ट्रायल्स की, it will not be supervised by the sponsor. He will hire a CRO and he will look into it. Okay? Then what are the responsibilities of investigator? That is the doctors. He should be well qualified. Okay? He should be a registered medical practitioner with a valid license. Okay? He should have adequate experience and expertise. Okay? So he needs to provide his CV. What are his qualifications, or how much experience he has to the sponsor. He will then decide whether he is fit for the research or not. Okay? Then medical care of the subjects, study subjects, is the whole responsibility of the doctor himself. Okay? Then monitoring and auditing of records also will be done by investigator, but under the supervision of sponsor. Then communication with the ethics committee, presentation of protocol or review will be done by investigator. Okay? इसमें दो रहते हैं, एक प्रिंसिपल इन्वेस्टिगेटर रहता है जो मेन डॉक्टर रहता है, इसमें जो पेशेंट से एनरोल करता है, ये काम करता है, एक को इन्वेस्टिगेटर रहता है साथ में, ठीक, एंड बोथ विल गेट रेम्यूनरेशन, लेकिन प्रिंसिपल इन्वेस्टिगेटर का ज्यादा रहता है, को इन्वेस्टिगेटर का कम रहता है. Then he have to comply with the protocol. Then एक बार स्पॉन्सर ने इन्वेस्टिगेशनल प्रोडक्ट या ड्रग को हैंड ओवर कर दिया इन्वेस्टिगेटर को, then it is his responsibility for the safety, storage and everything of the investigational product. Then selection and recruitment of the study subjects. It is the doctor who comes in contact with the patient. So enrollment of study subjects is his responsibility. Then informed consent process, very important, separate lecture is there. इतना जो हमने सुबह से कर देखे, the most important document that will save you in the court of law is informed consent. Okay, it's very important. So what are the different aspects and how it is done will be talked by Dr. Zubair in the upcoming session. And keeping reports, progress reports, they are also responsibilities of investigators. Then termination and final report is also responsibility. Even sponsor can terminate the study if he finds that the investigation product is not fit or causing severe harm. Then record keeping is documentation, what corrections you have made throughout the study. Then electronic data processing and how you will validate that data, that also should be mentioned, and it should be done in the language understood by all the members of the team. Yeah? ऐसे कोई rare language में आपको नहीं लिखना है कि only few persons are understanding and others are not. Then there are special guidelines for trials for vaccine, trials for contraceptives, then trials for surgical procedures or medical device, then for diagnostic agents or contrast media. Then separate guidelines are there for trials for herbal medication or Ayurveda or Unani medicines. Okay, we will not go into the details of that. So that was all about guidelines that our government has provided for conducting research or trials in India. Thank you.
Thank you, sir, for furnishing us regarding Indian GCP. Now I would like to invite Dr. Sheikh Ubaidullah sir to sensitize us about ICF GCP R2.
Dean sir and yes sir, we will start with the inaugural and then we will continue our session.
खाली पेशेंट देना है।
So, good morning everyone. And once again, I welcome you all for our GCP training session, January 2024. I welcome Dean Sir, Dr. Azhar Siddiqui Sir, our CEO, Dr. Ilyas Bimal Sir, and Dr. Ubaid Sir and Dr. Shafi Sir for organizing such a beautiful GCP training session. I now call upon Dr. Imran Sir to kindly felicitate our beloved teams. I now call upon Dr. Master to kindly felicitate Dr. Ilyas Sir. I call upon Dr. Uzair Sir to kindly felicitate Dr. Shafi Sir. I request Dr. Sukhmi Madam to kindly felicitate Dr. Ubaid Sir. I request Dr. Ubaid Sir to kindly enlighten Dean Sir and our CEO Dr. Ilyas Sir about the session of GCP.
So good afternoon. Basically, it is in between good morning and good afternoon. So better it should be go with good afternoon. So this is our first effort, particularly as you people know that recently we have established the Institutional Scientific and Research Committee, and here onwards our efforts will be there to make the research more comprehensive, more validated, and acceptable. So this is our first initiative. So we have targeted the members of ethics committee as well as the head of the departments who are principal investigators and who will be the investigators for our training. So this is important one because we need these things for registration of our different committees with the regulatory authorities. And inshallah, after that, this is just academic basic induction. In the future, we will again go with the advanced training modules. Hope this will be acceptable, and we are expecting the cooperation for each and every faculty. Thanks a lot.
I request Dean Sir to enlighten us with his words on research and research.
Good morning. Assalamualaikum. So I'm very happy that we are starting with this training in GCP, good clinical practice. Now we are aware that everywhere in NMC also this is being given a lot of importance. I hope everybody is now aware that NMC is having 4 sections. One is PG and UG board, one is medical assessment and rating board. And the 4th section what they have started is only for ethics. So ethical practices will be more and more given relevance in the future. Not only in medical colleges, they are starting this for all the practitioners in private practice. So all the kinds of what can say misconducts and everything will be controlled by one separate section of NMC. And as a part of that, they have started it at the undergraduate levels. If you see those who are aware of the first year timetable course, there are few topics concerned with ethics. And we are taking 3-4 lectures on ethics separately and as a part of ADCOM also. ADCOM तो यहाँ बाकी एक सिक्के लोगों को पता नहीं attitude, ethics and communication. नहीं वर्कशॉप हो गए बाद क्या थोड़े दिन बाद दिमाग से निकल जाता है ADCOM पूछे तो भी सब लोग जरा सोचते क्या है. तो attitude, ethics and communication तो हर ईयर में है. First year, second year, third year, minor as well as all subjects are having this. And one more thing they are starting with audit. Ethics से है
रिसर्च पे
एक और पार्ट आया है उसमें भी वो ऐड कर रिलेटेड पार्टी होगी तो उसी तरह हमको भी करना चाहिए और अपने पास अभी तक एथिकल कमेटी अगर एक्टिव है लेकिन रजिस्टर्ड सेंट्रल काउंसिल में नहीं थी जो ऑलमोस्ट हो जाएगी होने में होगी तो all kinds of research replaced by the ethical committee and we have started a separate research committee. I hope you have seen the circular scientific and research committee, Institute Scientific and Research Committee headed by Dr. Robert. So this committee is there to help you all in all kinds of research. So anybody want to take over in any research project, whether funded, non-funded or any kind of research, that will be committee. So you can put a synopsis on your project and submit it to this committee. They will regulate it. They will also guide you. If there are some mistakes in that, they will regulate guide. Once the scientific committee approves the project, then you can go it for ethical purpose for the ethical committee. So both these committees will work hand in hand and they will work together. So I request all the HODs, other faculties here to encourage your PGs also to take over various projects. Again, one more thing is how many of us are aware, I don't know, the university has started a lot of projects. University MHS. Only one project was there from one UG student. That is from Department of Pathology.
No, we had sent from Department of Pathology also, but it was not. It was accepted, but then during interviews it was rejected. But one UG student has got accepted.
तो बाकी सब लोग भी हम कर सकते हैं.
2 गए थे सर प्रोजेक्ट्स.
2 गए. University has started lot of funds for this. उनकी लास्ट ऑनलाइन मीटिंग हुई 1 महीना हुआ शायद. ओके. उसमें they were surprised कि अपने पास से मतलब बहुत सारे कॉलेज से प्रोजेक्ट आते ही नहीं. उन्होंने एक बड़ा बजट रखा. यूनिवर्सिटी के पास पैसा बहुत है. अपने हर छोटे-मोटे काम के लिए वो पैसे लेते हैं. तो वो पैसा they want to utilize it. तो मैं आपसे रिक्वेस्ट करता हूँ कि यूजी बच्चों को भी थोड़ा एनकरेज करिए. अपने क्लासेस में बोलो कि ये प्रोजेक्ट्स चालू है. ऐसे हमारे प्रोजेक्ट्स और भी नए प्रोजेक्ट्स होंगे तो इसे स्टार्ट करेंगे. So I think this is first step, baby step in this direction. और as he has said, we will start with advanced course also. ये कोर्स ऑनलाइन भी है. शफी सर के टॉपिक में साथ बोले होंगे. तो इसका स्वयं जो है, स्वयं जो एक ऐप है, जिसपे हमने GCP कोर्स किया है, उसके ऊपर एक इसका भी कोर्स है एथिकल का ऑनलाइन. शफी सर कंप्लीटेड, I have registered but I have not completed. So वो भी उसके ऊपर भी हम कर सकते हैं. So without wasting much time, I welcome you all for this high staff in-house, and I hope that everybody is enjoying these boring topics. Other topics are very awesome. It depends upon the person who are teaching. I will try to attend in the afternoon both the sessions. So we together will make the difference. And as our institute is already progressing, going in very good direction, right direction with the help of the management, yes, Richard Madam and Kuseba Sir. And under the blessings of our founder chairman, we pray also that he will be very healthy. उनका रहना ही हमारे लिए बहुत कुछ है. वो अगर खाली फोन पे भी कॉन्टेक्ट में रहते हैं सर के साथ, तो हमारे लिए एक गाइडेंस जैसा रहता है। और जब भी आते हैं दो ही सवाल मिलते हैं, कॉलेज कैसा चल रहा, हॉस्पिटल कैसा चल रहा, पेशेंट कैसे है। So we pray for his good health, and I finish my talk here. Thank you very much. और आपने सभी प्रोग्राम में से सबके जोश में ध्यान दें, उनकी ताली बजाएं।
Quite interesting, sir. Topics are quite interesting.
थोड़ा सा जो रिसर्च रिलेटेड थोड़ा सा अपने पास कुछ मिसअंडरस्टैंडिंग्स थे, फॉर व्हाटएवर रीजन, विल नॉट गो द डेप्थ ऑफ दोस रीजंस। थोड़ा हमारे पास लोगों का अप्रीहेंशन था कि रिसर्च थोड़ा ऐसा है वैसा है, डर लगता था लोगों को। तो कोई चीज डरने की जरूरत नहीं, हमारे पास जो भी काम होगा 100% लीगल ही होगा। 5% इधर उधर जो हमारे केसेस में हम थोड़ा बहुत करते हैं वो अलाउड रहेगा, बाकी कोई इलीगल काम हम नहीं करने वाले हैं। जो भी आपका रिसर्च रहेगा आप काम करिए, उसके हिसाब से आप करिए। तो आपके जितने प्रोजेक्ट्स हैं, फंडेड नॉन फंडेड जो भी प्रोजेक्ट्स हैं, बहुत सारे प्रोजेक्ट्स हैं जो अपने को मिल सकते हैं, आप स्टार्ट करिए। आप उसमें पीआई बनिए, प्रिंसिपल इन्वेस्टिगेटर, ये पूरी टीम आपको उसमें हेल्प करेंगे, इनकी पूरी कमेटी हेल्प करेंगे। इनके दो काम दिया हुआ है, एक रिसर्च, दूसरा पीजी मेडिकल एजुकेशन, पूरा इन्होंने कंट्रोल करना चाहिए। उसमें भी थोड़ी हेल्प हो जाएगी इस कमेटी। इसमें सब अपने ही लोग हैं, बहुत सारे जो यहाँ बैठे हैं उसमें से लोग ऑलमोस्ट पूरे ये कमेटी के लोग हैं। आप पीआई की भी फीस मिलेंगे, सर ने बोल दिया। तो जो आपको है उसके हिसाब से आप करिए। कब है प्रोजेक्ट डिसाइड करेंगे, इंस्टीट्यूट से कितना उसमें रहेगा, पीआई का कितना रहेगा, दे ऑल विल डिसाइड बाय द कमेटी, और फाइनेंशियल मैटर्स विल बी लुक आफ्टर बाय द चेयरमैन एंड सीईओ सर। तो कोई आप दिमाग में मत रखिए कि रिसर्च करना है कि नहीं करना, डर है, इलीगल है, लीगल है, कुछ भी नहीं। सब कॉलेजेस में होता, एमजीएम में करोड़ों का हुआ, करोड़ ऑफ रुपीस उसमें यूज हो रहे, जीएमसी औरंगाबाद में भी हो रहा है। जीएमसी औरंगाबाद में आई थिंक हेडेड बाय डॉक्टर लेक्चर, तो उसमें तो कुछ इलीगल होने का सवाल ही नहीं है 1% भी। और यहाँ पे भी भोसले सर इज 1 ईयर जूनियर टू मी, बहुत अच्छे हैं, इमरान सर नोज इट, तो वहाँ भी अच्छा चल रहा है, आप लोग भी कर सकते हैं, कोई प्रॉब्लम नहीं है। तो आपके अंदर जो भी मिसअंडरस्टैंडिंग है, यू कम एंड डिस्कस विद डॉक्टर ओबेद एंड डॉक्टर चंद्र, दे विल गाइड यू टोटली इन दिस, ओके। फाइनेंशियली आल्सो मैनेजमेंट इज रेडी टू सपोर्ट। एक बात अच्छी आती जा रही है, तो
थोड़ी देर चलने दो सर।
मुझे तो लगता है कि बात कर ही दो आप, फाइट लेके। थैंक यू। मैं इस स्पीकर में कहा था कि तुम्हारा कोई बड़ा प्रोग्राम हो छोटा, ये क्या कनेक्शन नहीं है, वो उतना प्रोग्राम तो आपका उस दिन क्या वो मैं स्पीकर पे आते हैं तो
Very busy person, sir.
वॉइस रिकग्निशन डाल दिए लगता है ना।
We are requested CEO sir to talk, but sir has told everything to Azhar sir. For your generous decisions, sir. I call upon Dr. Shafi sir to give vote of thanks.
Before I propose vote of thanks, sir has already mentioned that the institutional ethics committee and research committee both will work on one hand. Now there will be one circular from Dean sir. It will come projects which are going to take place in our institute should go through research committee as well as IC. There are many postgraduates, there are many faculties, they are coming directly to us, sir give IC clearance. So see IC clearance ऐसा नहीं है कि भैया आप आएंगे और हम साइन करके दे देंगे. No. See, it is the responsibility of the head of the department. Please ask your postgraduates and your faculties if they are publishing any kind of paper or doing any study, whether they have cleared their project or their study from the research committee and IC or not. And then you allow them to start the study. Now there are some journals, they are asking for their IC clearance, then they are coming to us. Now I can quote my department, this today morning they came to us, sir, we need the IC clearance. So why you are coming late? Well, you do in a scientific way, in ethical way, and then follow all the process. Because for postgraduates, thesis, one oral presentation, one poster presentation, one publication. These four things are compulsory. Ask your postgraduates for clearance from research committee, study committee, and IC. Then accept their poster, then accept their oral presentation, then accept their publication. Okay? So we have to streamline all research activities in our institute. So it is the responsibility of the head of the department for all the departments, particularly PG departments and all other departments. So I also request Azhar also that whenever somebody comes for a promotion, you see the publication, but you also ask for whether they have cleared it from IC or not, whether they have cleared it from scientific committee or not. So this workshop we have organized so that everybody will get sensitized, and in future also we are going to organize such type of workshops, because in PG regulation 2023 they have made it compulsory that all postgraduates should be trained in ethics. So to make you people a resource person for future workshops, we have organized this. So I hope that all of you will take note of this, that each research project should go through research and scientific committee and IIC, then only should be started. So I thank our CEO, Dr. Ilyas sir, Dr. Azhar sir, Dr. Vedula sir, and all the participants for coming and making this program successful. Thank you.
One more announcement, yes sir, has given the plan every year. We had a PG 31 now, maybe more in the future, inshallah. So, जितने भी अपने thesis रहेंगे, yes sir has said that we will can give this responsibility again Dr. Obed to see all the thesis get published. उसका एक criteria बनाओ, जो सबसे अच्छा रहेगा 1, 2, 3, those PGs and their guides will also be given prize for that. और उसके अलावा एक और सेक्शन बनाओ जिसमें हर साल जो सबसे अच्छे पेपर पब्लिश और प्रेजेंट उसको भी अपन एवरी ईयर 24 का से शुरू कर दो, तो हर साल वो फैकल्टी को भी अपन उसमें प्राइज देंगे।
ऐसे गाइडलाइन पब्लिक में स्कोपस में वेब ऑफ साइंस में जो पब्लिश करते
हैं उसका क्राइटेरिया
अगर सर किसी का पब्लिकेशंस का एज पर बहुत स्टैंडर्ड रहा तो उसका फाइनेंशियली पब्लिकेशंस का भी पैसा हम देंगे। बेनिफिट्स टू इंस्टीट्यूट एंड पब्लिश्ड जो ऑथर्स
तो एक उसके क्राइटेरिया बनाई, दो टाइप के, एक खाली थीसिस से रिलेटेड हर साल और एक साल भर का रिव्यू करना 1 जनवरी से 31 दिसंबर।
थीसिस के जिसका भी बेस्ट रहेगा डेफिनेटली बहुत वैल्यूएबल प्राइस रहेगा। ऐसा नहीं कि कुछ भी उठा के पेन किए, शायद वैल्यूएबल नहीं, क्योंकि इसकी वजह से स्टूडेंट्स के अंदर अवेयरनेस आएगा। प्राइस किसको मिला आपको जरूरत नहीं है, मगर मिले नहीं, मगर वो स्टूडेंट्स का अप्रिशिएशन उनको थोड़ा सा मोटिवेशन आ जाएगा। बहुत अच्छा देंगे, डोंट वरी।
Sir, one suggestion from my side. In the central library, we should have one section for the theses. All the theses, hard copies or soft copies, some kind of section we should have. From our department, we have already given 2 theses. They are for reference purpose, so we should have one section.
Central library also as well as the
Department also, we have some.
तो जितने भी कैंडिडेट्स आपके पास के गए उनका ऑलरेडी आपके पास होगी तो होगी
वन कॉपी टू द सेंट्रल लाइब्रेरी।
और यहाँ से आगे पब्लिश करने वालों को बोलो कि एक कॉपी एक्स्ट्रा रखना चाहिए, डिपार्टमेंटल लाइब्रेरी 2 कॉपी, एक डिपार्टमेंटल लाइब्रेरी और एक सेंट्रल लाइब्रेरी, तो 4 एग्जामिनर, 2 ये और एक उनके खुद के 7 कॉपी होना चाहिए।
सर आप 2-3 लोग रखिए, अगर ये सर ये फुल फैकल्टीज है तो उनको पास कुछ मटेरियल हो और वो आपको कॉल करे तो उनका मटेरियल स्ट्रीमलाइन करने के लिए आप ऐसे लोगों को रखिए कि जो उन लोगों को हेल्प करेंगे। बेसिकली क्लिनिकल टाइप के लोग हैं, उनको डिफिकल्टीज आती है, उनको ओटीपी करना है, स्टूडेंट्स को भी ये करना है, और स्टाफ वाइज भी। सर आपका थोड़ा सा कैमरा जी, स्टाफ वाइज भी ऐसा है करके
कुछ ही मीन्स कुछ पर्टिकुलर परसेंटेज में स्टाफ है तो उनको बहुत ज़्यादा बर्डन है, तो अब ऐसे कुछ लोग रखिए जो उन हेल्प करें। कुछ लोगों का मीन्स वो इसलिए भी नहीं करना चाहते कि उनके पास मैन पावर नहीं है, तो उनको आप ये